Recording has begun.
Okay, so, Nick, can you hear us okay?
Yeah, I can hear you great, thank you.
Okay, and Mr.
Keisha?
Keisha, can you hear us?
I can.
Okay, perfect.
I think we're ready to roll. Be that complicated. In person only, from now on.
Beauty of technology, right?
Do you want to, are you going to stay there, Kim?
Yeah, I got that one going.
Okay, all right. Well, I will call to order this January 23rd, 2025 meeting of Healthcare Advisory Committee. I guess we'll do a little roll call around the table. Judy Zengi is obviously not here, and she's, I don't believe, online as well. Amanda Robinson. Present. Lacey Simpson, present. Scott
Smith is here.
Sarah. And Dr. Tim Horn. Good morning, everybody. Thank you for being here. We do not have any communications. And that brings us to item 4, which is persons to be heard. Is there anybody here in the room that would like to address the Healthcare Advisory Committee? And I believe everybody who's online is here to actually present. So we'll get to all of you momentarily. Hearing and seeing none for persons to be heard, we'll move past that onto item 5, which is approval of the October 15th, 2024 meeting minutes. Is there a motion to approve?
So moved.
Second. Amanda, thank you. And thank you, Lori, for providing minutes. You were all given these in advance, so if you had a chance to review, if you caught anything that needs updating or correcting, please let us know. Okay, all in favor of approving the minutes, please say aye.
Aye.
Any opposed? None. Those will be approved. Thank you. So moving on to old business, item 6, we have a couple of community partner updates per request of the Healthcare Advisory Committee. We were hoping at the last meeting to hear from these folks, but that didn't quite work out. So on the line, we have a couple of individuals who I know Carl, but I don't know Nick. Hi guys. They are with True North Recovery, which, as Peace Health probably knows, is now occupying the former Aquila Car House facility to offer inpatient substance abuse services. So good morning, Carl and Nick. Hoping that you can give us an update on your services and progress at the former car house.
Sure. Well, good morning, everybody. My name is Carl Soderstrom. I am the founder and CEO of True North Recovery. Really appreciate the opportunity to connect with you guys and tell you a little bit about what we do and where we're at. So we're a behavioral health provider. We started out in the Mat-Su Valley, and we provide like a full continuum of care. So everything from crisis services to detox services and medical services, to inpatient, outpatient, and continuing care. We also operate in Fairbanks in a similar fashion, so kind of a full array of services. And we were really pleased to provide residential treatment in Ketchikan and pursue that opportunity. So we actually reopened on December 9th. I'm really excited about that. And currently there are 10 folks in treatment at the car house right now. We've kind of renamed it, but kind of not. So it's now the Cara House. There's a lady that really helped facilitate this named Cara Nelson, who was with us for a long time and is now doing some consulting work. But she's a lifelong Alaskan from Ketchikan and a person in recovery. And so we've renamed it the Cara House. So let's see, what else can I tell you? We've remodeled quite a bit and refreshed that program. We're also planning to launch some crisis services to allow folks to access residential, but also connect with other providers in the community. We hope to have that online by the end of quarter 1, beginning of quarter 2. And that will look like kind of a Monday through Friday 9 to 5 place where folks can walk in and get access to either assessments, which will help them, navigate what the right kind of treatment is. It'll help them get connected to some crisis peers and crisis case managers that can help find resources in the community or even outside the community and get them the help that they need. I don't know if do you guys have any specific questions or things or information that would be helpful, or are we on track for kind of what you were hoping for in terms of where we're at in an update?
I think so, but I'll open it up to if there's anybody here at the table that had specific questions.
I have 2 questions for you, Carl. It's Dr. Tim Horton. I'm a pediatrician, so luckily we don't get into too much rehab issues, but are all the residents that you guys are treating here local or from our local islands, or are they moved from places all over Alaska to here to be treated?
It's a great question, and it's certainly both. So there's a number of folks that are from the Ketchikan community. We were even able to help a young lady that was essentially knocking on our door one day. And then we also work with folks from around the state. And so, it really is about who's a good fit for that. And another great example is we've got about 3 folks since we opened that needed withdrawal management services from Ketchikan that we flew to our Wasilla location and put them through our withdrawal management program. 2 of which felt like treatment would be best had not in the Ketchikan community. So we've got some folks there that are now in our higher intensity residential treatment center in Wasilla. And I don't know, Nick, did we send somebody up to Fairbanks or?
Yeah, we have 1 person in Fairbanks, from Ketchikan. So they reached out to us and asked for help, and what was mentioned from them was that they did not want to do treatment in Ketchikan, and so they were able to come to us in Ketchikan and then find their way out and get the help that they needed in another location, and so that was pretty cool.
Yeah,
Great, sir.
And same for folks in the valley, they could potentially wind up in Ketchikan.
That's great. When the patients are here, do they establish with one of our doctors at Peace Health, or do you guys maintain all their medical care too as well, if they have side medical issues or anything like that?
That's a great question. We have a little bit of psychiatric capacity, so we can do a psychiatric evaluation and psych med management. We have a nurse practitioner that's able to do that for us remotely, but our preference is to establish care and community with other providers. And so they are likely coming to Peace Health. I know a large majority are already getting primary care or urgent care services from you guys.
Yeah, great. It's a great service, Carl. I mean, I'm really glad it's here. You listed 5 things off: crisis, detox, medical, inpatient, outpatient. Are all those services available here, or are you kind of shifting people around as you need through the organization?
Well, really, they're not all there. And there's other services in the community that we want to partner with. We don't really care where people get well. We just want to see them get well. And then we also, to be fully transparent, learned some lessons along the way. When we opened up our operations in Fairbanks, we did do everything all at once, and that was certainly challenging. It's worked out, but we just felt like the best service that we can provide is residential. That's kind of our flagship, and that was the opportunity that presented itself. And so we want to do that really well and then evaluate over the next year or 2 years what the community's needs are, and then we can determine what services we can add around in the Ketchikan community. In my opinion, right now, our recovery residents or sober living programs would probably be really impactful in Ketchikan. I know housing is a huge challenge, and I think a lot of folks are doing their outpatient services through the new RISE search program. They can certainly do some of that through us remotely. And I know Set Free Alaska has also recently joined the community and doing some remote services. And, you know, we're going to gauge feedback directly from graduates. And if they're feeling like they're not getting what they need or that's not working out for them, we'll certainly explore it. But for right now, it's residential only. The next step for us is crisis services. And then potentially something to explore after that would be kind of our recovery residence program. But that's going to be, we're going to have to ask you guys when the time comes what you guys think we need and what the community needs and what the clients need.
Great. Thanks, Carl. Sounds like a great project.
Well, thank you. We really appreciate the opportunity and don't take lightly the responsibility.
I have one more for you, Carl. What's the total capacity? You said there's 10 residents in there now, and what's the total capacity there?
Sure, it's a 16-bed facility. It fits more comfortably 15 folks, but so we'll try and keep it at about 15 folks with we've always kind of had a little secret bed tucked away for the one person that walks in that you just can't say no to. So we'll do the same there. And then our crisis capacity doesn't really have a cap, but that'll be open Monday through Friday, 9 to 5. And then hopefully, you know, as that progresses, we'll be able to open up on Saturday, Sunday too.
Thank you.
There are other questions? Carl, I had just a couple for you. I noticed just yesterday, someone pointed it out to me. There was a sign for, I'm not sure if it's sort of a transitional housing facility that is noted as True North, just further down on, I guess it's on Stedman Street. Can you tell us a little bit about what that facility is and how that relates to the main car house building and services?
That may be somebody completely new. That is not something that I'm familiar with.
That's very interesting because the person who pointed out to me said that it was in relation to your services. And it was noted as True North. So I'll have to check that out. If you don't know about it, then it's not what I thought it was. I thought it was maybe some sort of transitional housing or something like that. So
no, please let us know. I know we are going to purchase a little condo, but that's for our staff to come in because we really just believe in like being there with our people and like bringing our culture down. And so that's the only property that we're pursuing currently in Ketchikan. But I haven't heard of the project that you're talking about.
Okay.
Please let me know when you find out.
Yeah, I sure will. And in terms of
Nick, hands up.
what's that?
You see Nick's hands up.
Oh, okay.
Oh,
Nick,
I was-
sorry.
I was gonna say, so when I was down there last time, I was looking at some things online, and I know True North Family Health Clinic had temporarily closed, and I was wondering if maybe that was them reopening there.
I don't think so. This would be a pretty small
Gotcha.
building that
Okay.
I don't think would be suitable for a clinic. But
Okay.
yeah, I'll look into this. I apologize for mistake there.
No.
In terms of the residential services that you're offering at Cara House, I try really hard to use that one. I do like it quite a bit. What is the duration of that program? Is there a set number of days that you aim to have participants utilize the program, or is it really just continual assessment to see how they're doing?
Both, but there's certainly an ideal, and it's actually 121 days,
Okay.
and that can fluctuate, up to 6 months relatively easily. Our program has 4 phases: fire, water, earth, and air. And you kind of come in, your butt's on fire a little bit. Hopefully, the water puts you out, and then you get grounded, and then the air takes you on to the next phase. And if folks are struggling, they could extend or reset a phase. So if there is a change to that, that most ideal situation of 121 days, it's usually in about 30-day intervals. But that can certainly fluctuate. We haven't actually graduated anyone yet. And something that's really important to us is they have somewhere safe and stable to go to. And so that could have a pretty significant impact in Ketchikan. But that's kind of our ideal is 4 months.
Thank you. Any other questions? Carl and Nick, thank you so much for joining us and for giving us an update. We really appreciate that and hope to be speaking with you again before too long and seeing you in the community. So thank you.
Yeah, thank you for having us.
Absolutely.
Thank you.
So in the same topic, we invited Kasia Whiteman with RISE and KTVC and Search, lots of acronyms, to talk about the RISE Wellness Center and program, which again is former Aquila facilities up behind the hospital that offer outpatient services. So Kasia, whenever you're ready.
Well, good morning. Thanks for letting me join remote. I'm up here in Anchorage, so this was super convenient to be able to Zoom in, even though I heard you wanted everyone there in person, as I was fussing with technology as well. Again, Rise Recovery, we've kind of been, I'm going to say, taking a pronged approach, and I'll just kind of cover each of the three buckets. So part of what we've been working on is, of course, partnering with Search to get the MAT services up and going. You've probably or hopefully have heard that they did receive full accreditation and we're open for services, fully open for services, January 13th. So those are just getting rolled out. They've been doing, they were kind of doing what they could as the renovations were happening on that side of what we're now calling the Rise Wellness Center, formerly like the Aquila building. We've renamed that, but we were working on that, and I have a scheduled update with them tomorrow, so I can't tell you how many people they've seen since they've been fully open for business. But we did receive a report that their phones were ringing off the hook. So I think that means they're probably busy. And they are providing medication-assisted treatment, along with they do have nurse practitioners on site, and so behavioral health component, groups, really the full gamut of addiction services. And so the second bucket that I'll talk about, and again, they kind of overlap, is the facilities piece. So when we took the building, took ownership of the building, there had been probably significant deferred maintenance. And so as part of getting ready to become fully compliant for Search, we renovated half of the building and then moved the Search temporarily into one half, worked on the other half, and now we're fully completed half of the renovations, and we're in the process of evaluating the remaining half, as well as what used to be called the Top of the Hill facility and the duplex at Peyton Place. All of them need a variety of, some of it will say Band-Aids, and some of it's a little more intensive. We've heard about roofs. We've worked collaboratively with the city in identifying some of the larger issues. We've addressed plumbing issues, underground wastewater. I mean, it's been pretty extensive. So that has been really a key focus. And then the third bucket, and again, these all overlap, is really the establishment of RISE as its own nonprofit entity. We did file for a nonprofit last fall. Unfortunately, the IRS is kind of backlogged at this point in our case. Our application hasn't even been assigned to anybody, and that's happening throughout the system. And so we're kind of at the mercy with them to become fully IRS 501c3 certified. In the meantime, we've been working with Ketchikan Indian community, and recently just received a grant from them to start determining what services we're really going to be offering. We've been working collaboratively with several community partners, attending the monthly wellness coalition meetings, and reviewing, I'm going to say, about the past decade of needs assessments that have been done across Ketchikan. Kind of in the same vein that we heard from True North, is trying to roll out services incrementally and be strategic about what we offer. We know we've seen some of the models that didn't work, and so we're trying to be cognizant of lessons learned and move forward in a way that will be sustainable in the long term. That was a lot of the feedback we heard from our community partners in Ketchikan is, while access to services is really important, several of the community members have been, kind of on a roller coaster of services being available and then not being available. And so coming in a way that's strategic and sustainable for the long term is the direction we've had from our board. And that's the short overview. I'm assuming there'll be questions for me too. Again, I was trying to put it in 3 buckets, but they're all obviously intertwined.
Great. Thank you very much, Kasia. Are there questions from? All right. I guess this was a question that maybe I should have asked the True North folks, and I guess still can. But what is KTBC and RISE doing in terms of, I don't know, I guess sort of publicizing or making it known what services are? I don't know enough about this field to know how folks find the services, but how do you get the word out? I know that you had kind of a well, you've had an open house, you've had sort of a community meet and greet, things like that. So can you tell us a little bit more about that community engagement component?
Sure. RISE has been walking hand in hand with services, with Search to promote their services. Less so, we're not really actively providing services today. So we've been working with them on their service delivery plan and rollout and outreach. There is another event, that's a good reminder, thank you, scheduled tentatively for February 12th. I believe that this is all going to roll out in the next week or so, and they've been doing a pretty robust marketing campaign, and it's included, they had events throughout November, which is Recovery Month. They've been doing flyers, Facebook. We've had a series of community outreach events. It wasn't just one, actually. There's been several. With the final approvals from SAMHSA, the state of Alaska, and the DEA that just happened over the holidays, this next event will be really a full rollout of all the services they're offering. So additionally, I know they've done newspaper, and just really trying to be present in the community, again, attending events and putting their name out there. They've hired staff, and I apologize that I don't have the number of staff, but they've hired several members of the Ketchikan community that people already knew. And so that's part of one of, an added benefit of having local people on the ground. When RISE gets up and going, we want to take the same approach. We think being in Ketchikan is really important. Making those human connections, I think I do the best I can from Anchorage, and it is absolutely not the same. And so we want to have a presence of our staff and in Ketchikan on the ground.
Great, thank you. All right. I don't think we have any further questions, Kasia. So thank you so much for joining us. We really appreciate it, and I'm sure we'll talk with you again soon.
Yeah, thank you for your time.
Yeah. Okay. So moving on to old business, item B, which is update on same-day clinic, which has been sort of a standing item of ours, and I believe Sarah, you prepared a little presentation.
Yeah,
So
it's really kind of short. It's just that we are continuing our services, and it seems to be very much appreciated by our community, and it's being utilized. Yeah, that's all I have.
okay, Okay.
Keep it going.
Okay. Do you want to walk us through your presentation? We have Tim, I
Sure, I
think,
can.
pull it up. Tim or Lori.
Yeah, just some updates on leadership.
Yeah. Have it here. We can just go through the whole thing. Yeah.
Okay, I'll share my
Yeah.
screen.
It flows into the next one.
I
Okay.
can't do anything. I don't have any power. No one made me co-host or anything. I can't even mute my
Oh.
video. I have the presentation here, but
You have it up?
I have it up, but it's not showing up, so.
Okay, can you see my screen?
No.
Not yet.
Oh, okay, I thought I shared.
So did I.
Love technology.
I just love it.
I clicked share, but it didn't do it.
Today is a day of technical difficulty.
Yeah. Okay.
Let's do this in the interest of time, since the folks here at the table have a printout. Oh, hey,
Hey.
I just had to threaten it with
That's right.
going to paper.
Can you, Lori, can you go back one page?
Yes,
Thank you.
hopefully. Yes, there we go. Here's our team.
This is our team. So we're excited to have a full and present team.
Yes.
So there's myself, along with Dr. Livengood as our Chief Medical Officer and Jennifer Moyes as our CNO. So, and she is from Bellingham and has been a Peace Health employee for like 30 plus years. So it's wonderful to have her up here.
I just realized that I was remiss at the start of this meeting, even though we all here know that Sarah Cook is now the new CAO for the hospital. Yes, excellent. Lots of applause. When we last met as a committee, Sarah was not yet on the Healthcare Advisory Committee. So now you are. So that's official, and that's again at Peace Health's discretion. But just wanted to state for the record that Sarah is now part of this committee, even though I think I sent that in an email. So
Well, thank you.
happy to have you.
Happy to be here. And just, we can go to the next slide, Lori. We talked a little bit about the same day clinic, that everything's going well, and the community continues to utilize the services, so that's great. The next slide is just a little bit about our 3 stages of renovation, and we are in phase 1, the CT phase, which is going really well. The construction's underway. Marble Construction is doing a fabulous job, and we hope to have the completion done this summer. June is our hope to have that done. The second phase will then be the laboratory, so giving them a little bit more space and updating them as well. And then the third phase will be our ER renovation. Next slide. So I've had the opportunity to get to meet with Nick and Keisha and earlier before this. So we have all been in several meetings and discussing just behavioral health and the services that we can offer all together as a community and work together. Peace Health still remains a DES designation, and we are connected to IRIS. They do our initial evaluations via telehealth. And it's been going really well. They've been really responsive. And then we're going to continue to collaborate with RISE, True North, and KIC to help serve our community. Next slide. Just a little bit about caregiver engagement. We are really focused right now on how to recognize our caregivers and how to retain. So it's really important to the executive team and everybody here sitting at this table. So we're going to continue to do some of our traditions that we've done in the past, and then add to that, just try to listen to our caregivers and see see what makes them feel valued and continue to try to recruit and retain. So this is a picture of our Jingle Mingle. I know that there's also lots of little things on Facebook of, I think this wonderful doctor sitting next to me got to do a song, Christmas song. It was, you guys won, yes, they won. It was wonderful. So just a lot of fun, a lot of giggles that week. So, all right, next slide, Lori. All right, probably what everybody is most interested today. So our ED, on October 31st, we were notified that our ER physicians weren't getting paid by anyone. And we tried to be in contact with them and they were radio silent. We later found out that they went bankrupt. But through all of this, we established contracts with all of the physicians with NES that wanted to be here in Ketchikan and continue to compensate and insure them. And so they have their malpractice with us and their tail coverage and everything is covered by Peace Health. We've been able to consistently maintain 24/7 coverage in the ER. And we are currently in an RFP for a new group to hopefully take over the ED specialty by the fall.
Great. Just to pause on this
Yep.
if we can.
Yep.
Questions.
I'm pausing.
Thank you. Just again, lots of, different comments made in the community. So those physicians now are under contract with Peace Health to
Correct.
offer those services. And there was obviously a lapse in compensation when NES stopped paying and then Peace Health started. Has that been resolved? And it's not really on Peace Health necessarily to pay for the time when they were under contract with NES, but was that resolved in some way? Or is there still a gap in which staff was not compensated?
I will say that from everything that I know, that Peace Health did everything legally that they could to
Excellent.
compensate
Okay.
them
Great.
fairly.
Yeah,
Mhm.
okay. Excellent. Okay, so RFP soon, and then by the fall, hopefully a new contractor. Is there anything in that contract that is markedly different from the contract for services that you had with NES? No? Okay.
We were just looking for a group that can provide services to our community that we are used to
Yeah.
and that has the Peace Health mission and values and can continue to work with us to support our community. And
Great. Okay.
I have a question.
Yes.
Now that they're contracted with Peace Health, does that change patient billing?
it does.
It does.
Yeah, we are billing for
Directly
services.
from Peace Health instead of the,
NES, correct. NES continued to collect billing until we signed contracts with the physicians.
And I'm just going to ask, just because it was one of those points in the lease negotiations, that all subcontractors of Peace Health are in network. So I'm hoping that RFP clearly spells out that they would have to be in network. Perfect.
Yep.
Okay.
Yep.
Marvelous. Okay. Thank you for
Yes.
that.
Yep. We ready to go to the next slide?
Yeah.
Or you guys, okay. So this is also exciting. Right now, healthcare is extremely hard to recruit and retain. And Ketchikan not being any different, maybe even a little bit harder just because of our location, weather, and all the things that come with living in Ketchikan for some people. We have some new providers that just started with us, Dr. Bonzo, new pediatrician who we all already love. He's just wonderful. Him and his family are great. And then Dr. Miller is also new in family medicine. He's a wonderful gentleman as well. Really glad to be here in Ketchikan. And then we have Gabriella Madsen. She's an NP that's going to be starting this month in Prince of Wales. So they're really lucky to have her and excited to have somebody who is interested in living in Prince of Wales. So, and then Anna, I'm not sure how to say her last name. Chacon. Okay. She is going to be our visiting dermatology. I know we've talked about her a little bit in the past and just working with her to get her schedule, but she's going to hopefully start in March. Yep. And then we are continuing to interview. Right now we have orthopedics that we're interviewing, another for primary care, and then general surgery as well.
Very excited to see
Yeah.
a traveling dermatologist.
I know, me too.
She's quite talented. She has
Yeah,
a lot she can
she
offer. She's gonna start up slow and just see what she can do, but she
Mhm.
does Mohs and a bunch of other things, so it's
That's
gonna be
great.
great.
So what did you say the three position categories that you were interviewing currently? There was orthopedics.
Yes,
primary
which we have a
care.
very, very strong candidate. So we're really excited. And then primary care and general surgery.
General surgery. Okay. Great. Are there any other positions that have been, I'd have to look back at maybe the last report card. There's certain positions that I know are just nationally are super difficult to recruit for that we've had out there for a while. Are there any of those that you've made progress on, or I don't even remember what they are?
Yeah, I'm sorry. I don't I'm super excited to have this. I think we've been looking
Yeah.
for family medicine for a while. So I think that was one of them, and to have Dr. Miller join us, and we were looking for a pediatrician. I don't know how long you would know.
3 years.
3 years. So those were a couple that
Yeah,
we were looking
That's
for.
great.
So,
Yeah, I think, pediatrician was one, and maybe it was radiology or something. I can't remember.
Radiology's been taken over by the Bellingham Group, and they've been doing a great
Okay.
job. They have somebody up here every week for us, and multiple talented people. So it's been really good.
Wonderful.
Really good.
Specifically providers? Or
Yeah.
you're not talking about nursing and
No.
ancillary supports?
It was, actual providers,
Yeah, everybody's been pretty good. Dr. Reisman from Hematology Oncology retired this year, and so there's a fantastic doc coming up to do that. Take his place, big shoes to fill, but I think he'll be great. Dr. Woods retired from GI,
Mhm.
and so there's a new GI person coming up. A little fluctuation in cardiology, but I think that's going to be stable for this year too. So it's really, I think everything's great. I think Sarah's got everything set.
Yeah.
It's good.
That's excellent. I'm happy
Yeah.
to hear that.
As far as nurses and techs and different things,
We should knock on wood, but it's good.
Yeah.
It's going to be a good year.
Okay.
yep. And we're doing a couple of different things different with recruiting for like nurses and techs, is going to some of the schools across the country and meeting with the graduating classes.
Nice.
Trying to
Yeah.
sending our local managers to kind of have that face to
Yes.
face and be able to speak to Ketchikan.
Very
Sure.
good.
High school program's up and running again too, which is really nice too. So that'll hopefully be a
Pipeline.
pipeline for local
Yeah.
people to come in. So it's
Great.
exciting.
Okay.
Got a lot of kids apply, so
And our surgical tech program in the OR is doing great.
that's a
So,
really exciting program
yep.
too.
We've had several people finish that and are working. So,
Strong
Really
people
good.
too.
Excellent. Okay. Thank you. Any other questions? Thank you very much, Sarah. I appreciate that. Okay, well, we'll move on to our new business items. The first one we have is an update on housing initiatives, which was brought up at the last meeting.
Yeah.
We did provide a report that was penned by Peter Amelon at the Borough, which is fairly comprehensive. Hopefully you had a chance to read that. If you have questions, I can try to pass those on and get you an answer. But just to sort of state sort of the lay of the land with the two governments, the city is pretty limited in its powers in terms of what it can do for major housing initiatives. For a variety of factors, most notably that the borough has planning and zoning authority. And so they're obviously, as indicated in Peter's report, doing a lot of work relative to their code, relative to zoning, different housing initiatives. So they've got a lot of different irons in the fire, which is great to see. And the city is again, not as able to do quite as much, but I did want to have Amanda speak to what we are doing, because obviously it's been a concern for our city council as well. So we're trying to do what we can. We have the capacity and the authority to do. So, and if you want to speak to that a little bit.
So, generally, what the city has is property that has been either transferred to the city by an individual or someone, or has been tax foreclosed. So we have currently 37 properties that have the potential to be auctioned at some time. 11 of those are tax foreclosed properties. The issue with those is that there is a time period at which the previous owner has to pay those back taxes and take back possession of the property, and that's 10 years. All 11 of 10 years.
Wow.
So all 11 of those foreclosed properties that we have are within that 10 years.
Wow.
Which if we wanted to try to auction those, it's a lot more paperwork to go through to try to notify the interested parties, give them an ample amount of time to pay the back taxes, and which has all already happened, but we have to go through that process if we wanted to try to offload them. So we are looking into the best ones that we could potentially put that effort into to try to get these properties back on the market so that people can either take possession or build or something like that. The other properties are difficult for us to offload because of some paperwork issues. Deeds, titles, flats, things like that would take our legal staff and our public works staff time to sort through and try to reconcile. So we are, working with the manager's office to try to figure out ways that we could potentially get through this mountain of paperwork so that we can start to get rid of these properties and get them back on the market so that people can develop them. But that's kind of where we're at right now is sifting through strategies on how we can get them out there.
We did a surplus property auction like 2023. Was it 23? Yeah. Yeah. So almost 2 years ago. And those were all of the, I would say, low hanging fruit.
Yes.
Property that we had that, we had clear title to, they were appealing. And so we were fairly successful in getting rid of those properties. I don't know if this has changed at all. I will say that I asked, do we have any status on on these properties since they were auctioned? And I think at that time, only one had actually been developed into housing. So the intent, of course, is to create more housing, but once they're out of our hands, then it's truly out of our hands and up to the new property owner. So,
But, what I find here is that we tend to sell properties to people down south. And so they're out of sight, out of mind.
right.
With big companies. And I wonder if we could sell properties to more local people. And I think about, again, if you want people to stay here, you get them involved in the community, you get them buying things, you get them managing some properties. There's quite a few movements in the physician communities to own properties and move them. There are big groups that do that. Dr. Chacon actually is a member of it. And so, I wonder if you can't do it illegally, and I don't mean to imply that at all, but if just letting people know and encouraging local ownership in some of these properties would be really helpful. And I think we have, high earning people in the hospital that can do that and help with that.
Yeah. I will say that in our last auction, which is how we have to run it for fairness.
Sure.
And availability. It was a lot of local.
It
people
was.
Good. Good.
properties. Yeah.
But maybe you can help us, promote that
Mhm.
in the hospital and amongst the groups would be helpful.
Yeah.
We know we have a lot of nurses that own properties and do that. I think the old labor and delivery has like a project going. So great.
Yeah, we can keep you informed when we
That would be
hopefully have
great.
another auction go up. So
Maybe these high earning doctors could create a little LLC to buy property and build multifamily housing or
Absolutely.
something.
And it just takes one doc to organize the others or one, and I wouldn't even say doc because our whole, there's the medical family over there is pretty tight. So, everybody's very interested, I think.
Yeah, I think
Are most of these properties multifamily? Are they single family that, you know,
They're
do you know?
just land.
It's
most of
land.
them.
Okay, so
Mhm.
full on
So it would
development.
take, a
That's a little
group that
harder.
had some capital
Yeah.
to develop.
Right.
Yeah.
So
Yeah.
This next round will have some more, I think, actual structures
Yeah.
because
we
they
do,
are.
yeah,
Those are
we've
probably
got
easier.
3 that are actual structures, but they do need.
Yes,
Yeah.
as you can imagine,
Yeah.
as we all talk about roofs,
Yes.
that if it's not been maintained and been
Right.
sitting unoccupied for years, what the state of the structure is. So,
We are
And
personally
and a lot
familiar
of
with how
times
much work
when
it
we do
takes.
take possession, they were not in a good state to
Yeah,
do it.
sure. Well, if it's been
Right.
sitting for 10 years, it's probably.
Right,
yeah.
Mhm. Which we do some maintenance on them to keep them viable. One of them, we did replace the roof.
Great.
So we are doing some maintenance of what we can.
I read through this. I don't know much about this process, but it sounded like it's all you can do, you know?
Yeah.
It's
Yeah.
a lot of,
Really, the only thing under our jurisdiction
Yeah.
is building code.
yeah.
And we
Yeah,
work
zoning
very
and stuff like
closely
that.
with contractors, developers, and everyone to get through that process as smoothly as possible.
Yeah.
I think this is helpful to us too, for us physicians that have to live near the hospital. I
Mhm.
mean, almost the entire range of what I can get to in the hospital in time is industrial zoning.
Right.
You
Right.
know? And so there's very few home choices for a physician on
Mhm.
call. And that's really challenging for recruiting, particularly people that want to come in and live on the water and stuff like that, which is very difficult here.
Right.
I mean, you know, the trucks have great views that are rusting in that whole area, right?
Yeah.
And we can't get the docs in good views and the nurses and stuff like that. So, yeah, it's frustrating, but
It's definitely a challenge.
but great. This is helpful.
Yeah, on the subject of our code, thanks for mentioning that, Amanda. We are going through a process to update our uniform building code and our fire code because both need an update and
Great.
they work together. So hopefully in the next several months, we'll be able to introduce the ordinances that would change those. It's again, a funny thing having two governments because the borough has not adopted a building code. So if you were building out in the borough, it's much more free and open. There's just very few limitations there, whereas the city has a building code that you have to work within. And some contractors and property owners really don't like that, but we do it for the precise reason that we started with, so that these properties do not come back to us in derelict condition and they don't pose public safety threat. So
If you are going to build in the borough and it's anything larger than a duplex, then the state fire marshal does review those plans. And then if you are being financed, typically whoever's financing it will require some minimum code.
Mm-hmm.
So, yeah.
Great. Well, thanks for putting that together, guys. I appreciate it.
Quick question on the properties. Yeah, I'm sure there's some legal guardrails so excuse my ignorance, but what I was curious about, when these auctions happen, are they truly, you pretty much have to auction them off and let them go and they do what they want to with them, or?
as long as they're doing it within the zoning code. So if it's zoned residential, whatever they do has to be for residential purposes. They couldn't erect a.
So the idea of doing something more like a partnership where the land was at a more reasonable rate for somebody to develop with some expectations or some contractual language that says you will do, multifamily property on this, and this is what we need, and.
Yeah, so those are things we've talked about at a very high level, and it's not impossible. But our council hasn't really gone there yet. We've talked about that with respect to like a comparable would maybe be giving property to Path Park Avenue temporary home. And that would be some level of partnership and used for a very specific reason. So it's not impossible to do that, but right now our direction has been to get these off of our hands, them out to the public, get them back on the tax roll and hope that somebody develops them. So, but certainly, there could be some sort of contractual or other partnership arrangement where the city designates property that it owns for a specific purpose and lays out expectations. So, yeah, we just never done it before. So, yeah.
And it would be directed by council.
Yep.
So,
Yeah. So.
Thank you.
Any other questions on housing stuff? No? Okay. Okay, we'll go to the next item, which is capital improvement planning update. So as I'm hoping everybody knows, and I think definitely most people do at this point, as part of the lease agreement, when we went through that process, we identified a very long list of capital items for the hospital in different stages of priority and cost, and whether or not it would be, a Peace Health cost, a city cost, or a shared arrangement. Amanda, Scott, and Sarah and I met just last week to sort of start to pick this thing apart, because neither the city nor Peace Health has really been in a financial position since the lease was enacted, because of COVID, because of Peace Health basically dedicating all of its capital to the ED remodel. We've not really been in a good financial position to start picking away at a very long list of capital projects, which are mostly maintenance oriented. They're not necessarily expansion, with the exception of the ED. So we wanted to get together and kind of talk through where we're at, because there are projects on that list that were slated for 21, 22 that we just haven't done. So we're in the process of going through that. Scott very nicely consolidated everything for us, and so we're working through that. But I'll just pass these around.
14 by 17 paper
Yeah,
makes me nervous
I know,
already.
it's double-sided.
And double-sided, awesome.
And huge, because it's a very big table. But yeah, just to give you an idea of the different projects that are hanging out there, the estimated project cost is probably moot at this point for a lot of them, because it was done back in 2010. A lot has changed, or if the particular project has worsened. But when we met the other day, we kind of established that there's a couple things that really need some attention that both the city, Amanda's office, and Scott are kind of working on, which is there is some water intrusion in the old CT area that requires immediate attention. So we're working on how to approach that. The other one is some roofing delamination over in the K-Mob, and I wrote that down, and then I realized I don't actually know what that acronym means. But Amanda has reached out to the manufacturer to figure out, since it still should be under warranty, how we get going and making those repairs. So those are the two prime projects that we know that we need to work on, but we do need to continue to revisit this big list, which Scott and Pat have been working on. So I know it's a lot to absorb, but just wanted to give an update to say that we are trying to get back on track with the projects. We know that we can't just let everything linger forever, but also recognize there's a lot of constraint there. So Scott, I don't know if there's anything you want to add to that.
Well, I can just add that like you already stated, the first step we all agreed on when we met was really to go through this again, identify, so some of this has been dealt with, identify what on this list. This was basically taken directly out of the lease, so it hasn't been. So anyway, Pat and I met once, and he's starting to comb through it, and then we'll use this information, this spreadsheet, to pull out the things or identify the things that have already been done, and then try to put some priority, at least from the Peace Health facilities perspective, to these, and then talk through them and see if between the city and Peace Health, those priorities make sense. There may be things that the city feels are about too, obviously. So we would hopefully, I think what we agreed to is by the end of the month we'll have the review.
Thanks, Scott. Yeah. So that's pretty much where we're at with capital projects. So just a little update there, and I really appreciate Scott and Pat going through this, and of course the work that Amanda does. Amanda's very familiar with the
hospital at this point is. So I anticipate that she will continue to have this be a focus
I've
of her
spent
work.
some nights at this hospital for repairs.
Yeah. Yeah, I'll make sure that we take care of that building, and it's a very interesting one, given its age and different expansions, so, yeah. Okay, so that is the end of our new business items, which is onto future agenda items. Are there any other topics that float to mind for the committee to address?
We have quite a bit of road work planned for
Yes,
next year.
yes.
So I don't know if we want to have that as agenda item because I know it really impacts access to ER and employees and parking and everything, which is already a challenge.
Yeah,
So
so
do we want to?
we'll see what their schedule is
Great.
for next year.
Great.
They're supposed to go from Holdley Creek all the way down to Elliott Street, which is that set of stairs across from the helicopter spot.
Gotcha.
And so last summer, obviously, they did a lot of the sidewalks and curbs. They still have that whole second section to do. Looking at their schedule from what they got done last summer,
Okay.
I don't know if they'll get to paving
Yeah.
this summer or if they'll have
Gotcha.
two crews going. I'm not sure.
Yeah.
So we'll touch base with them, get their schedule. So starting at Holdley Creek, that's right at Carlana, you should still be able to access Carlana and the ED
Okay.
without much interruption
Okay.
from the north,
Good.
from the south. They do have to maintain a lane. They will have a ton of flaggers out,
Great.
making sure, but it could be another situation where the main entry would be, I don't know if closed, but we'll have to talk it out.
Great.
But we could do something like we did last time where we go through KIC. So if I'll make sure that you guys are in the conversations for
great.
that work
Yeah.
happen, just like we did with Dory last time. Like we went on site, talked about everything just to make sure that everybody was comfortable with what was
Great.
going to happen. So
Hopefully by the next meeting in April, we'll have a very clear picture of what
Yeah.
the plan is. So yeah, happy to give a better update at that point.
Great.
But hopefully at that point, it's not a surprise to you either because
Great.
Amanda will have had conversations with you.
Great.
So,
Yeah. And just keep parking in mind for us too, as well as our employees going to
Yes.
park all over the place. So
yeah, so we have the parking lot next to we call it ramp 4, but
former VFW.
yeah,
Right,
former
right.
VFW,
Okay, great.
that'll be paved this
Great.
summer. I think that's really high on the
Yeah.
schedule, so that should
Right.
happen like pretty much first paving.
Right.
And then
I
once
think we
that's
just need to make sure that signal crossing is like working.
Yeah.
I think there was an accident there a couple of weeks ago of somebody
was.
crossing and,
yeah.
that the
I do
device wasn't
have-
working.
I do have on my list to talk to DOT about more street lighting in that area.
Great,
Mhm.
great,
It's pretty dark.
great.
So
Yeah.
yeah, there's
Awesome.
been quite a few vehicle pedestrian accidents lately,
Yeah.
and it's concerning.
Yeah.
We'll need to pay attention, but also it's been dark,
Yeah.
raining.
And people are wearing dark clothes in the winter
Mhm.
and everything. It's been hard.
Yeah. So,
All right. Sounds like you have good plans. Thank you.
yeah.
Any other items for our next meeting? And certainly it doesn't have to happen here if you think of anything in the next few months.
Probably this should be.
Yeah, we can definitely update on that. Yep. That would be good. Okay,
I'll probably be able to give an update on where we are with the ER staffing.
great.
Yeah.
Yeah.
So I'll keep
Yeah.
you guys as soon. Yeah. I'll keep you in the know.
Perfect. Okay. All right. Well, if there's nothing further, guess we can adjourn.
Thank you.
Thank you
Thank
guys
you.
very much. Sorry for the technical stuff.